It's an important question. How do we treat currently smoldering myeloma? And I think we have maybe some rules that we have to think about. The first thing is we need to better define who is truly high risk in smoldering myeloma. We do have good clinical parameters now, but I think we need to add to it so that we don't overtreat or undertreat certain patients with smoldering disease. I think the second step is we need to understand better which subtypes of smoldering myeloma should be treated with different treatments. I think the rule that in overt myeloma what we usually do is we look at the biology, but at the end of the day we treat them all the same way, should not be applicable to smoldering myeloma. We have an opportunity, we have a chance now to say an 11-14 is different than a 17p in smoldering myeloma, different than someone who has a bad immune system in smoldering myeloma. And can we develop therapies that are truly precision medicine, truly precision interception or intervention in those patients with smoldering disease? We're starting to think of precision medicine in smoldering myeloma. You can think of potentially 11-14 translocation is an early oncogenic event, and think about potentially developing venetoclax trials in those patients. It's an early event, it happens in many cases, and can we potentially cure myeloma or have a longer remission if we start using venetoclax early? But that's just an example. We don't know that that's true. I think of patients who have a p53 or a 17p deletion with high risk smoldering. Likely I would not treat those patients with just lenalidomide and dexamethasone, just like the clinical trials currently. I want to give them a more aggressive approach or an immunotherapy approach. So those patients, we would probably treat them in a very different way. And I think in the earlier setting, in a high-risk MGUS, low-risk smoldering myeloma, can we harness the immune system? Can we use immunotherapy, vaccines, other options to completely normalize that bone marrow and then reactivate the immune system and maybe prevent myeloma from happening in the future?